Good afternoon, everyone. As we know that the tsunami of diabetes has already taken over the globe, and India being the second largest populated country, and 70% of the population is being resided in the rural population. So this rural population cannot, the underserved population cannot be neglected. So we just try to initiative with the help of ASHAs to increase the diabetic retinopathy screening in Varda district. So basically the present study highlights the role of ASHA in screening for diabetic retinopathy. In this, we have mentioned their role, but many studies have mentioned their role. But this study we have practically intervened with the help of ASHAs for effective screening of diabetic retinopathy. Screening was done with the help of a non-mediatic fundus camera, with the help of trained ophthalmic assistants, and fundus photographs were uploaded on a online software which was further graded by ophthalmic surgeon at the base hospital on ETDRS classification. Patients who needed further management were referred to base hospital. We done the screening part in two phases. In phase 1 was done for over the period of 8 months, in which screening at CHC was done without intervention. Intervention was training of the ASHA workers. In first phase there was no intervention. Fixed facility screening was done at CHC, SDH and DH. Remote grading of fundus photograph at base hospital by retina consultant and online reporting. Feedback and referral of DR patients to MJMS for investigation treatment. The registration was done on an online Android-based software, and patient fundus photograph were taken by a non-mediatic fundus camera, and reporting and referral was done on online basis from base hospital. The patient who needed management were referred to base hospital, and respective investigations were done like FFA, OCT, and the patient which needed further like laser treatment or intravitreal was done according to the need of the patient. In phase 2, all the non-diabetic patients were line listed by the ASHA worker at the PHC and subcenter level, and this intervention was done over the period of 4 months. Training and orientation was done with the help of structured IC material in local language, that is Marathi and Hindi. Audiovisual posters, leaflet, focus group discussions and peer support group were made. Monthly meeting was done at primary health care center with medical officer and ASHA workers. And similar procedure of consent, registration, demographic detail and fundus photography and diagnosis with teleophthalmology and management was done as followed in phase 1. These are some posters which were used during the intervention. These are photos of leaflets and pamphlets. These are the photograph of meetings done at various center, and this intervention was done at 4 center initially, and 1 center was without any intervention. So now screening was done with the help of ASHAs at primary health center and sub-centers. The result was 5,400 patients were screened total, and out of which 375 were referred for diabetic retinopathy and 81 patients were treated. Now here you can see the trend of number of diabetic patients screened in different blocks. Now up to August there was a first phase intervention, and as we put up the information in 4 center, in one of the center we didn't done the intervention, and as you can see the number of patients screened over the period of 8 months were similar to number of patients which was done in 4 months, and the intervention was done over a period of 1 month in each block. As you can see the rise, and one Varda block as example, that's 793 patients were screened over the period of 8 months, but similar 885 was done in next phase. Now this is a trend of screening over the period of year. As you can see the spike as the intervention was done in month of August, September, October. And now this is a cumulative trend of the screening in various blocks, and the last RV there was no intervention done with the help of ASHA, and there was decline in the number of screening. Now, basically, the ASHA, we can say that it is a ray of hope in diabetic care in the rural India, because it can helpful in conducting awareness, raising campaign on diabetes, generally to prevent the onset of diabetes and complication, identifying the cases of diabetes within the community and referring them to diabetic care facility, blood glucose monitoring, motivating expectant mother for blood glucose testing, diet and exercise counseling for the people with diabetes, encouraging regular follow-up to clinic, early detection and complication, and their referral. Now the present study basically highlights the role of trained ASHA in making the annual screening of non-diabetic patients for diabetic retinopathy more effective and robust in the rural population of India. Study emphasized the importance of early screening of diabetic patients for diabetic retinopathy for preventing avoidable blindness due to diabetic retinopathy, screening at government health facility at all levels, training of ophthalmic assistant in taking fundus photographs using non-mediatic fundus camera, use of teleophthalmology, use of online-based softwares and Android applications for data entry, storage and processing, and proper referral system and awareness about diabetes mellitus and diabetic retinopathy among the non-diabetics. their family and community with the help of trained ASHA will make the screening for DR robust and effective in the rural population of India. In order to tackle the rising problem of avoidable blindness due to DR in developing country like India, such methodology can be streamlined on a larger scale. Thank you.